rebuilding healthcare together. We know that New Brunswick is beautiful. It's rural and urban. We're bilingual with close-knit, strong communities. We're multicultural and we're innovative. And at the heart of our communities are hospitals or community health services where New Brunswickers have access to quality healthcare services. Medicare is Canadian. It's part of the DNA of being Canadian, and that makes us proud. We know that healthcare is very important to New Brunswick's communities. In order to maintain our healthcare system, we as New Brunswickers need to ensure that our province's healthcare system is sustainable. However, right now, we're at a tipping point. Did you know that it costs $6,000 per minute, over $8 million per day, that's over $3 billion per year to run New Brunswick's healthcare system? There's a misconception that the federal government covers all or most of New Brunswick's healthcare costs. Only 20% of those costs are covered by the federal government, while 80% of those costs are covered by us, New Brunswickers. New Brunswick's healthcare budget has grown substantially over the past decade. 10 years ago, the province's healthcare budget was $1.7 billion. Now, in 2012, the healthcare budget has almost doubled to $3.1 billion. In fact, 41% of the government of New Brunswick's budget goes to the healthcare system. And if we don't do anything about it, then it will continue to grow and could reach 50% in the near future. We have got to live within our means. So, you may wonder how we're spending $3.1 billion and where exactly this money is going. People. Healthcare is people. 74% of all our healthcare spending goes to our fellow New Brunswickers, our neighbors, our friends, our families, the people who work hard to provide us with healthcare in New Brunswick. Controlling healthcare costs is important to ensure a sustainable healthcare system. We need to make sure that we organize and allocate our healthcare workers as efficiently and effectively as possible. We need to better match our resources to our needs. Not only will this help curb costs, but it will help ensure that New Brunswickers get the right care at the right place at the right time. We are the unhealthiest province in Canada. 70% of New Brunswickers have at least one chronic disease. We have the third highest rate of heart attack, and we exceed the national average on smoking, obesity, physical inactivity, and poor mental health and wellness. We need to take ownership of our health. If we want to lead healthy, happy lives, we need to focus on our own health behaviors. When we look at all of the factors that contribute to our health, our own health behaviors play a significant role in how healthy we are. We're an unhealthy province, but the good news is that many health issues can be prevented. We just need to think differently about our own personal health. We can start making small changes to make a big difference.
Et on sait que les déterminants de la santé, il y a 40% qui vient des comportements des gens. On prend des mauvaises habitudes de vie sur une période de 30 ans, 40 ans. Donc, si on veut faire des changements, je pense qu'il faut se donner le temps de se défaire de nos mauvaises habitudes, donc de se fixer des petits objectifs. Je crois qu'à long terme, c'est beaucoup plus payant que des gros objectifs. C'est pas un changement temporaire, c'est un changement de mode de vie. Donc, en faisant des petits objectifs comme ça, c'est beaucoup plus payant. Ici, à Edmundston, on a développé un petit concept, la prescription-action, où on s'est regroupé des médecins pour essayer de montrer par la bonne exemple. Donc, on organise des événements d'activité physique concernant la nutrition. Je pense qu'on a mis de côté l'éducation justement des enfants concernant les bonnes habitudes de vie. Je pense qu'on a mis ça un petit peu trop de côté. Puis il va falloir revenir à la base pour améliorer la santé de notre population.
It's no secret that our population is aging, and something different is happening. The number of baby boomers are outpacing the growth of our youth, and soon enough, the working age population. This will have a major impact on healthcare. When people retire, their tax contributions and income both decline. And as people get older, they naturally require more healthcare services. So, right when we need healthcare services the most, we'll be least able to afford them. Our aging population also faces another challenge. Right now, a quarter of hospital beds in New Brunswick are occupied by seniors. If we don't change what we are doing, then it's predicted that by 2021, all hospital beds in New Brunswick will be occupied by seniors who could live happier, healthier lives in another setting outside of the hospital system.
About 20% of my patients are over the age of 65, but they're taking almost 50% of my time to manage their chronic illnesses. We need to move from an individual provider care model, like we use currently, to a collaborative care model where all of the professionals, physicians, nurses, nurse practitioners, pharmacists, and all of our other allied healthcare team members, we need to work together to help our aging population. Well, I think as a community we need to provide for our seniors services and programs that will help them maintain their health as well as help them stay in the community at large. We need everybody, politicians, physicians, allied healthcare professionals, and most importantly the public, to put politics aside. And everybody is going to have to work together to make this happen.
We have all turned to the ER as a last resort with that nagging flu, our baby's thermometer toppling temperature, a health concern with an elderly family member. We wait, sometimes for hours, to be seen to have our healthcare concerns addressed. While our health concern may not be an emergency, we still go to the ER. Why do we do this? Visiting the ER costs taxpayers double what it costs to visit a family doctor. Double! The best place to get the non-emergency care you need is in a primary healthcare setting, such as a family doctor, family practice team, nurse practitioner, telecare, or a community health center. Access to family doctors is an issue in our province, yet we have more doctors per capita than most provinces in Canada. 93% of New Brunswickers have a family doctor, compared to the Canadian average of 86%. A challenge we have is that only 30% of New Brunswickers can get a same-day or next-day appointment with their family doctor. That's 15% below the national average. On top of that, only 22% of New Brunswickers can access their family doctor after hours. When New Brunswickers need non-emergency medical attention after the workday, most or 78% have to head to an after-hours clinic or their local ER. New Brunswick's doctors and primary healthcare providers are working together on improving this issue because the best place to receive non-emergency care is not in the ER, but with your primary healthcare provider.
It is all about access for New Brunswickers. We have to get in our minds that primary care and family medicine is really a team sport. I think we have to get ourselves away from a provider-focused system and more towards a patient-focused system. The patient has to be at the center of everything that we do. I think integration is really important. We've really done a good job of working alone together, but my goodness, the time is now, if it ever has been, to really help us be able to integrate our healthcare here in New Brunswick. We have to help our healthcare professionals organize themselves into teams so that our patients can get the best type of healthcare that's available to them right here in our own communities in New Brunswick.
A nurse practitioner is a nurse with what we would call some advanced education. We do all kinds of different aspects of care, acute and chronic illness management. We like to say that we treat the person, the family, and communities. Teams work together, everyone achieves more is just really important to me. In the health center, I have access to physiotherapy, a pharmacist once a week, a dietitian once a week, as well as diagnostic imaging and lab, and other sort of health providers such as nurses and LPNs. It takes the team, I think, to improve the health of a person. If there were more groups of healthcare providers, like say a couple of physicians, a couple of nurse practitioners that worked in group practices, that's improving access so that the patient doesn't have to go to like the emergency department.
We are a small province of only 750,000 people, and our population is dispersed throughout the province, which can present challenges as our resources are spread thinly to reach all New Brunswickers, unlike provinces that have most of their population living in dense urban centers. But about 90% of New Brunswickers live within a 1-hour drive of a regional hospital, where specialized treatment to most of our healthcare concerns is available. Together, we can work to solve this problem by ensuring there's an integrated province-wide network in place in which people can work and be served in their language of choice. It's time to start thinking about how our healthcare system can be better connected to provide New Brunswickers with the right care, in the right place, at the right time. We know that healthcare is people. But what happens when our people are overworked, exhausted, and worried about providing the best possible care to their patients?
Si on compare la province du Nouveau-Brunswick avec les autres provinces canadiennes, on est dans les provinces qui investissent le plus d'argent dans notre système de santé, puis qui a le plus de médecins de famille et de spécialistes. Je pense pas que la solution, c'est d'en ajouter, mais bien de regarder à notre efficience puis notre efficacité. On a un problème organisationnel à quelque part ou de priorité. Qui crée tout ça, c'est qu'on travaille tout un peu séparés, un peu en silo, puis il n'y a pas de moyens définis pour communiquer ensemble. Puis ça, je pense que c'est parce qu'on manque d'infrastructures, on manque de facilité, de ressources puis de moyens de communication entre nous autres. Je pense que c'est important de souligner que la qualité des soins au Nouveau-Brunswick est élevée. En général, c'est très, très bien, mais ce qu'on disait tantôt, c'est que le fait qu'on ne travaille pas toujours en système ou en équipe peut diminuer ce niveau de qualité-là. Par contre, il y a des spécialités qui ont été avant-gardistes. Si on pense à la chirurgie cardiaque à Saint-Jean, ils offrent déjà des suivis post-opératoires serrés à domicile avec des machines que les patients apportent avec eux, portent sur eux, puis ils peuvent analyser leurs signes vitaux à distance. Ils ont des suivis qui se font par téléphone. Donc, les patients qui habitent loin peuvent retourner à la maison puis ont un suivi pratiquement comme s'ils étaient à côté de l'hôpital.
While there are problems with our healthcare system and challenges do lie ahead, we as New Brunswickers need to realize that the future of healthcare can be bright. It can be sustainable. It can be different. We can have an enhanced quality of life in this province. To do this, we need to be forward-thinking and innovative. We need to have a vision. We just need to think about doing things differently. It's time to have a conversation, New Brunswicker to New Brunswicker. It's time to talk about rebuilding healthcare. We need a vision and a plan for a sustainable healthcare system now and for the generations that will come after us. We know it won't be easy. We know that numerous challenges lie ahead. We know that we cannot let our healthcare system, something we have worked so hard for, something we believe in, continue to show cracks and eventually crumble through our fingers. It's time to talk about a healthier future for New Brunswick.